moving arm is aligned with the
lateral
epicondyle of the femur. Okay, so what we need to, the most important thing, I've seen this on a few lab practicals. A lot of people, when they test this, keep your knee straight, extend your knee, and then do hip flexion for me. Okay, so I've seen this a lot on lab exams. Okay, what's going to happen there? Why won't you be able to go through a full range of motion? Because your hamstrings are going to limit, right? So we have the patient do this with their knee flexed. So go ahead and bring your knee up towards your chest as much as you can. Try to keep your toe and knee aligned with your leg. Don't rotate in or out. Try to keep your pelvis level. Try to keep your trunk relaxed on the mat, okay?
Okay.
With this, some people who don't have normal range of motion, they'll have some soft tissue from either their abdomen or their hip area, pelvis area, so that may limit their ability to get the full range of motion, which is what value? Anyone know? 120 degrees? Okay. And I'm going to raise as much as possible so that I can measure eye level. Okay, so go ahead, keeping your toe pointed straight up and forward, okay, not rotating your hip, keeping your pelvis level. Go ahead and bring your knee up towards your chest. Measure here. Oops, sorry if I was rubbing that on you. Okay. Okay, so as far as you can go?
Yes.
And relax. Good. So, she has about 110. Okay, it might be that the towel is in the way. I don't know, but.
A little tight. That might be it.
Is there anything else you want to add? I think that was good. So, greater trochanter in line with the midline of the trunk, lateral epicondyle of the femur. You may recognize some of those landmarks from the knee. Normal is 120. Okay?
Substitution for that would be?
I would say in general, when I do it, I see that the hip goes into external rotation. That's a common one. Sometimes they'll try to rotate their contralateral pelvis over. Okay? And what's the other one I was missing? Just basically the pelvis may move, the hip may go into rotation, which it's not supposed to, and sometimes they can move their trunk too. I've sometimes seen that, but mostly just watch the pelvis and the hip rotation. Mostly.
I see the head and shoulders come up off the table. It's not going to help them any. It's not an effective.
They're trying to use their abs or something.
But yes, they'll want to do that and do a crunch and pull their head up, but it's not going to help them.
Okay, now.
Motion.
What if you have somebody who's like a really overweight person who has a lot of abdominal?
That's what I was saying.
Yeah.
If they have like a pan